So my name is Mark James Herr. I'm an orthopedic surgeon, so I practice in orthopedic surgery. So orthopedic surgery is surgery on bones, joints, tendons, nerves, blood vessels, all that stuff. There's kind of two elements to my practice. So I'm in clinic and then I'm in surgery, and they're very different. Clinic is we meet people, we teach them about their problems and try to figure out how to get them better. A lot of my practice is problems with the hip, knee, foot, and ankle. So knee arthritis, hip arthritis, ankle arthritis, injuries, fractures. We treat those patients conservatively if we can. That means without surgery, medicines, physical therapy, braces. But sometimes those problems can't be treated without surgery and we operate on them. I became an orthopedic surgeon because I was lucky enough to have a biology teacher who took an interest in students that were particularly interested in biology. And his tennis partner was an orthopedic surgeon, and his other tennis partner was a DNR agent. So the DNR agent would bring in all the roadkill to the biology class, and we would dissect the roadkill. And so my biology teacher realized that I sort of liked that stuff more than the other kids. So he thought it would be interesting if then I met his other tennis partner, who was the orthopedic surgeon in town. So at age 14 to 15, I was actually able to perform my first knee replacement, which is pretty exceptional and probably nowadays would not be how it's done, but I was lucky enough to get in the OR and see orthopedic surgery as a young person, and that was totally what I wanted to do. So what I like best about being an orthopedic surgeon is I think I'm able to carry out my family tradition. My parents are both college professors or teachers, and so I think the best thing I do every day is teach people about their problem and help them understand what's going on and then understand how to get better. The things I think the patient should understand before the appointment when they come to see me is I think it's really good to have an idea of what they need. I think to know what their problem is, so they can say, I have pain. Pain is something we want to get rid of. That makes sense. But what are you trying to get back to? What are your limitations? The more they can give us that information, the better we're able to meet their expectations. It's good to know dates of injuries. It's good to know sort of the most specifics that they can. So anything they can kind of bring to that appointment, whether it's pictures, it's x-rays, and just to remember the things that happen, it's super helpful for us to help get on the same page with them and then create a plan to help them. I do offer a number of special services and unique things. A big thing we're doing a lot of is called platelet-rich plasma injections. So plasma is the fluid in your blood. Platelets are the cells in your blood that create clots. We can take a patient's own blood and spin it down, isolating this fluid plasma and these cells called platelets. And then we can actually take them and then inject them into the patient's body. They have growth factors in them, so the patient can basically heal themselves. And we can do that in a way that has a very highly successful impact: knee problems, tendon problems, ankle problems, hip problems. So that's something that I think we offer, and we can do it at I think in a way that's very competitive regionally in terms of cost. I think we're very effective, and that's good. So that is a clinic-based procedure. I do robotic knee surgery. So I use a robot to actually do knee surgery that helps me do it more accurately, more efficiently. I think that's exciting. I do something called digitally fluoroscopically navigated total hip procedures. So I do total hips from a direct anterior approach, where we can replace the hip without cutting any muscle. And we can use basically a fancy x-ray machine to do measurements of both hips to make sure that we're matching the patient's opposite side exactly perfectly. So it's just a fancy way of giving the best possible total hip. I do ankle replacements, and that's a different technology. We use patient-specific guides. So we basically develop an ankle replacement in a digital model and then create jigs for that patient to perform the perfect ankle surgery. It's really important that we make connections with patients. And the hard part of that is we have to read the patient to figure out what they want. And an example is if I have a patient that, like my parents was a college professor, they actually like to hear the Latin terms in medicine. They want to hear the Latin because they think that's important and they understand it. But a lot of my patients, if I use Latin, I can't connect with them because they just won't understand it. So I think it's important to connect to the patient to give them the information they want. And some patients don't want too much information, it overwhelms them, but some patients can't get enough. So the connection has to be, meeting in the middle of me giving that patient what they want that day to kind of understand the direction that we're going to go to try to help them be better. Outside of work, I have a lot of interests. I enjoy playing hockey in hockey leagues in town here. I'm a golfer and I've enjoyed golf for a long time. I'm not very good, but constantly trying to get better. I have pets that I like to walk and care for. I have 2 young sons that I enjoy spending time with. I enjoy reading, spending time with family. The best thing I think about Olmsted, there's 2 things that I think I enjoy most. The people here are authentic. The people that work here, my coworkers, I think they care for people. I think they care for the area. I think they care for Southeast Minnesota, Southern Minnesota. And I also enjoy the patients. I think the patients are real, and I think they're nice people that have problems, and I think they're in a position that they appreciate what we have to offer, and I think they want to get better, and I think they're great to work with.